A 34-year-old male patient, he came to the general practice and he's complaining of, focus with me please. So number one is painful, something that is painful, scrotal swelling. So there is a swelling that is painful. He has a past medical history of VHL, and in examination there is a lump that is posterior and separate from the right testicle. No erythema, gross scrotal enlargement, or dysuria. Okay, the patient is apyrexial and normal vital signs and tumor markers are normal. This is an excellent question, giving you all the differential diagnosis. So the question is, what is that differential diagnosis of a scrotal swelling? It could be a cyst, it could be a tumor, it could be a varicocele, it could be an hydrocele, right? So every word here is telling you something. So VHL is not very relevant, to be honest. It is related to one of those, and we're gonna know which one of those that it is related to. So number one, it's a painful swelling. So painful tells you a few things. So a cyst could be painful, a tumor could be painful, a varicocele is more or less painless, and hydrocele is more or less painless. And we forgot one, which is an epididymal orchitis, right? Epididymal orchitis, which is very painful. So there is a lump that is posterior. So tumor can come posterior, a cyst can come posterior, and varicocele and hydrocele, again, yeah, it could be, but it's not actually something that comes posterior. But the key word here is separate, something that is separate from the testicles. So hydrocele is never separate. Varicocele is most of the time connected. So it could be a tumor, but testicular tumor is not very separate, and it could be a cyst, could be an epididymal orchitis. So a cyst or epididymal orchitis. So now the patient does not have any erythema, and there is no gross scrotal enlargement, and there is no dysuria, and this excludes the epididymal orchitis. So I believe the diagnosis would be, so it's giving you the option that we just mentioned. Is it a hydrocele, epididymal orchitis, or a varicocele, or it's testicular cancer, or epididymal cyst? So from what we've said, so it's a swelling, so it is a lump that is posterior and separate and painful. So that goes along with epididymal cyst. So again, this is the question and this is the answer. We answer the epididymal cyst is a cause for scrotal swelling and palpated separate from the body of the testicle. There are several clues in the vignette pointing towards the epididymal cyst is typically tender. So it's typically tender. We mentioned earlier that it is a painful thing. It is found on the posterior and it is separate from the testicle. Okay, VHL causes multiple cysts around the whole body and predispose to an epididymal cyst. All right. So a hydrocele is widespread, non-tender, hemiscrotal enlargement. Epididymal orchitis is basically unilateral testicular pain, and there is a swelling. It may be associated with symptoms like urethritis, which we mentioned earlier, and less likely in examination finding. A varicocele is much more common. 80% of the swelling is varicoceles, and present on the left side. 80% of the varicoceles is more on the left side, and it has an explanation. We'll come back to it later. And it's basically because the drainage system on the left side is more likely to be obstructed because it drains into the left renal vein. So the testicular vein goes to the left renal vein and not to the inferior vena cava. And this is why this is more likely to be obstructed and cause left varicocele, which is more common than the right varicocele. Although this patient is a peak age of testicular cancer, this tender lump is found in the posterior. This testicular lump is found in the posterior and separate from the testicles, whereas testicular cancers were present as painless lump on the testicles. Furthermore, tumor markers, which is the main point here, are normal, which make the diagnosis of cancers less likely. However, after all of this, you need to get an ultrasound to give you an idea whether it is a cyst or a mass, okay? So that will be your next step in the management. But the question here is, what is the most likely diagnosis? So quick recap, an epidermal cyst, these are the most common cause of a scrotal swelling in the primary care. It is separate and posterior and tender. It is separate and posterior and tender. It's most likely associated with polycystic kidney disease and cystic fibrosis and VHL. Okay, so anything that has multiple cysts can cause the epidermal cyst. Thank you.